Knock, knock. Hi, Frank. My name is Alex. I'll be your nurse today, and I was saying for you to give you a partial bath and do some peri-care. Now, I will check Frank's armband, make sure that he is Frank, or he or she. And this is Frank. So then, I would provide privacy. I'll move the collar for the time being. And I'm going to shut the window if there's a draft, or adjust the temperature of the room to the patient's liking. So I would raise the bed. To a workable height. I'll put my gloves on. Alright, we're gonna say my gloves are on, because they're on. I have all my supplies right here on this table. You probably can't see it that well, but they are all there. And I'll remove this top blanket, keeping a sheet on so he doesn't become exposed. I would fold my blanket up. I would fold it nicer in a real setting, but right now I'm going to fold it like this and put it in this chair. I'll take my bath blanket. And I'll cover Frank here. Like so. Now that Frank is covered, I can remove his sheet. So I'll try and keep his bath blanket sheet on, which can be a little easier said than done. Make sure that stays up there. There we go. So I've successfully removed the sheet without exposing Frank. And I'll put this sheet right on the chair here. And now I noticed in the procedure it didn't have to take off the gown, but I'm gonna wash unless take the gown off. So I'm gonna make sure Frank stays covered and make sure it's okay with Frank that I take off their gown. So I'll just remove the gown like so, and Frank covered. Now reach over here. I can probably go this side. And I can just reach under here and grab Frank's gown, thus making him still not exposed. I would put his gown in a dirty linen container, but in this case we're going to use the same one. I can't find another one, so we're going to use the same gown after we're done. So I would raise Cedric and lower Frank. And we'll go obtain my water. So I've got my water here. I got some peri wash for his water, so I pour some peri wash in there. Get mixed up. grab my other towels as well. Side here. And I would have Frank put his hand in the water and make sure that the temperature is to his liking. And once it is, then I would proceed to get a washcloth ready. Get it nice and wet for him. Bring it offer to Frank if they would like to wash their face by themselves, or if they need help, I would help them wash, rinse, and dry their face. So I'll just form a mitten-like thing here. That, put it over, and I would start with washing his eyes from inner to outer on both sides. Like first I'd wash this side, flip it, wash the other side, put the rag in the basin, get a clean rag without soap on it, rinse off his eyes, and then I would take a towel and dry off his eyes. Same thing with his face. If he couldn't wash his face, I would wash his face for him. And then I would take a washcloth, rinse his face, and dry his face as well. That includes his face, ears, and neck that I would do. So, after done with that, we'll move to his left arm here, where I will take, probably raise his bed up a little bit here. There we go, I should have done that earlier. I'll reach over, place his towel underneath Frank's arm, lifted it up above the wrist here. Set it in there so it doesn't get his bed wet during this procedure. And then I'll cover his arm up with a towel as well. Just keep him from being too exposed. So I'll take a new washcloth and I'll get it wet, with soap on it, of course. And I would move the towel, wash Frank's arm from wrist to shoulder while lifting up the arm, getting underneath here, and getting his auxiliary. After I'm done with that, I would wash, and then I would take another towel or white rag, and I would rinse everything I just washed, and then I would take a towel like this one and dry Frank's arm. And I'll put my towels back here. And I'll cover him back up. And then I would do the same thing for the other side. I would remove the blanket, place a towel underneath his arm, then place the towel over the arm, get a rag ready, take the towel off of his arm, wash from wrist to armpit and shoulder, and then also rinsing the same area and drying it. While I was doing it, I would be raising his arm by right here above his wrist. So I'd wash, rinse, dry. Now set his arm back down, remove the towels, and proceed to washing Frank's back. First thing I'll do is get him position on his left side. So I'll scoot him over this way a little bit so he doesn't fall off the edge of the bed. Okay. Position. Put his arm over here. Usually Frank would hold the side row of a situation, but since he can't, I'm gonna have to do my best to hold him up. So I would, like I said, he'd be holding stuff up, so I have two hands. I can take a towel and put it down here, just so if it gets wet. And I would take a washcloth, I'd wash his back. And I would rinse his back, and then I would dry his back. and then usually proceed to lotion the back after this, but we've already done lotioning. Good to go. So I'll move this towel. I'll put Frank back on his back. I'll keep it covered up as best I can. Straighten his legs out here. And then I will proceed to peri care for Frank. Now in this case, Frank is a girl, so we're going to assume Frank is a girl. So I would make sure there's privacy, of course. And I would remove the blanket up so far, like so. I'll try to keep Frank exposed as possible. I have some pillows here to help put Frank's legs up, just to make the cleaning easier. So these pillows are for helping with elevating Frank's legs. So I would acquire a new washcloth. Get it nice and wet in the same water. Replacing the water if need be if it got too cold. We're going to assume this water is stayed warm or I changed it. So we got warm water here, full of soap. Get it wet, wring it out. Then I would form a mitten around my hand again. So I'll do that here. Wrap it around. If I can get it wrapped. There we go. Then I would go I will wash Frank's peri area from front to back while flipping. So like you flip this like so. Then we'll wash it again from front to back and do that as many times as need be. Then I'll put the washcloth back. I'll get a clean washcloth with no soap. I'll do the same thing. I'll make a mitten, wash from front to back as I'm turning the washcloth for new sides each time I'm doing it, so I'm not cross-contaminating. Then I'll take a towel and I will dry off the area that I've washed while also flipping the towel, making sure I'm not cross-contaminating. Excuse me. I cover Frank back up here. I'll remove the pillows, so that's the one here before. That later. I will put Frank's clean gown back on. I'll remove Frank's arm here. Now I'm keeping the back blanket on so Frank still stays covered up. So this whole time we have not really exposed Frank too much. And then we'll put his or her left arm in. Get it all positioned here. And then I'll put Frank's covers back on too. Usually to be folded in this case and to be easier to unfold onto the bed without disturbing any of the air. But we are just going to put it on the best we can right here. There we go. And then I can remove the bath blanket now that he's covered up with these ones. So I'll just pull the bath blanket right out of here. As you can see, Frank is still exposed, or not exposed, excuse me. I'll take the blanket, I'll put it in the soil linen bag, along with my items here, my towels, put those also in my soil linen. Take my wash basin, bring it to the proper area to get it washed and disinfected. And then I would Frank back down to his face height. Place Frank's call light within reach. Attend to anything that Frank needs. Clean up the room if necessary. Just tidy up anything that needs to be tidied up. And I would remove my gloves, dispose of those in the trash can. I would wash my hands, and then I would exit.